Today in the series of Docplexus KOL interviews, we have with us Dr. Rohinder Lall. He's an ophthalmologist from Andaman and Nicobar Islands. He post-graduated from RP Center, AIMS, Delhi. He was the HOD of a government hospital in Post Blair, Andaman and Nicobar Island. He started his first eye clinic in Andaman. He's also the recipient of NSPB National Award and Lieutenant Governor Commendation Service. Thank you for the interview, Doctor. So your first question is, what are the unique challenges that you face while practicing in Andaman and Nicobar Islands?
See, Andaman and Nicobar Island, it is almost 1,200 kilometers from the mainland India. So, and it is a small island having a population of around 4-5 lakhs and having nearly a island, as you say, this is island, and having nearly some 60 island inhabited island where the peoples are there, and the main island is our place is the Post Blair, South Andaman, where the majority of the population lives there. And there are two types of Andaman Nicobar Island. It is divided. So as I have already mentioned, it is island. So island, when there is an island and it is such a cutoff from the mainland India, so naturally it will have its own inherent problems. So in every field of this thing, particular medical science, and ophthalmology in particular, because as you know that ophthalmology is last 2-3 decades, it has really developed. Now it is all lot of instruments has come. So when you are practicing ophthalmology in Andaman, the main thing, because no company representative lives there, they have an office there. So anything goes wrong in any of the equipments, then when I was in government, it was very difficult because you have to get the engineers from mainland and then get it repaired. Before that, you have to get clearance from the administration. Till then, the machine is out of order. So these are the main challenge which we have. It is not unlike mainland. When you call any engineer, you can call them anytime, and even minor thing you can get it repaired. And whereas I'll tell you one small incident that there was a Humphrey perimeter, there was two switch was there. By mistake, he has changed the 15 ampere to 5 ampere and it stopped working. So we didn't know what to do. The person came and told me, he said, I don't know what happened, the instruments are not working. So, since there is nobody and this is such a sophisticated instrument, and that too from the Kaljais, so we can't touch. I have to call the engineer. He just came and changed the switch. He said, sir, because you have changed this thing unknowingly, so we could not, that machine was not working. So these are the, this, if you take, this is such a small, but for that he has to travel all the way. And when there is anything happen in other instrument, then we always face. And second thing, as you know, Andaman, when I was there, initially I was the only ophthalmologist. There's one ophthalmologist used to come from defense, in defense establishment. When you don't have enough ophthalmologists, you don't have interaction. The professional interactions are not there. So we are lacking. So when you don't have professional interaction, naturally, you start forgetting the subject. Like in Delhi, I know every week they are having CME program, which we don't have. I just come for this conference once in a year and maybe two conference, DOS, and whatever I acquired my knowledge and go. Of course, I read. But anything when you do interaction, when you have a discussion, you have more knowledge. You gain more knowledge, you retain it also. So those things are there, which is not in Andaman. We are, I'm lacking in that way. And as far as suppose you have some problem, you can't even have a second consultation with anybody. See, when you do cataract surgery, there are some complications which bound to occur. It is not in our hand. Like somebody may develop some infection, some may develop this thing. One infection, if I come across, if some patient develop, I have to refer it to mainland. Once I refer to mainland, I can refer either to Chennai or to Calcutta. And once I refer, it becomes a big news in whole of Andaman that Dr. Lall has operated and the eye has lost. He has to send it to Chennai. So these are one thing, which very challenging. Even the small, like, uveitis, you get a post-operative uveitis in cataract surgery, which is very common. In mainland, people are there, they can consult some other doctor, they say, yeah, it is common, don't worry, you take treatment and you'll be all right. But whereas if you don't have here much doctor and, patient take it, that common thing, it takes is a failure of, they put it as a failure on the part of surgeon, that he is failed to conduct proper surgery. So I am developing infection, whereas the surgeon has got nothing to do with that. So all this, the complication, what I feel, which is normal complication, that is taken as a failure. They put it to the failure, the surgeon failure. That is very important, when you practice in a small island, very isolated island. And like, you do cataract surgery, you have a modern surgery, phaco emulsification, and you remove the cataract by phaco emulsification. And phaco emulsification, one of the dreaded complications, that the nucleus drop. I can't think of having a nucleus drop, because the moment I have a nucleus drop, the second day I have to send it to Chennai. And you can imagine the status of a surgeon. You operate somebody and you ask next day, you take a flight, you spend nearly 1 lakh rupees, because up and down going, then the surgery there, the cost. So you can imagine the condition of the surgeon once he. That's why, I try my best not to have any nucleus drop at this. In fact, I have developed certain technique like a flip and chop technique, where you have a minimal stress on the zonule as well as in the posterior capsule. You won't believe, I never had nucleus drop in my life. I have been doing phaco surgery for the last almost 20 years. I started almost way back 1997, 98. So, but I never had, because I am very particular. If I cannot think of nucleus drop, and somehow I felt this flip and chop technique is better than to do cracking inside the capsule, where you are bound to have some time. So that is where I changed my pattern, and even today, I can do both, but I try my best. I make sure that there should not be a nucleus drop. And I feel anything, I always go for this type of technique also. So these are the challenge, which surgeon ophthalmologists face in Andaman, what I feel.
Moving to our next question, how will you tackle all these challenges, and what is the future of ophthalmology in Andaman and Nicobar Islands?
Actually, as I told you, like I gave you example of phaco surgery, I have changed the technique. I have changed the technique so that they should not be, and I'm claiming also that I have never had a nucleus drop. Like that, the more, see, the only thing I feel, this can be, we can have a challenge. They say now we are got a medical college in Andaman. Now it is undergraduate level. Now afterwards it will become a postgraduate. Then we'll have more faculty. Now the faculties also increase, and more residents will be, postgraduate student will come, senior resident. When you have a medical, you have series of all this. So your strength will increase. Once you have a strength, increase your strength, the awareness, the more doctors will be there, the more interaction. Like earlier, when Dr. Lall was alone, whatever he does, as I told you, complication taken as a failure of the doctor. But when lot of ophthalmologists come, then the patient can have interaction with other doctors. They can also explain, no, these are normal things, don't worry. So this is how, when our medical colleges come, I'm very sure that this will grow. Once these people will, more ophthalmologists will be in the island, and once there is a lot of medical hosts, maybe some of the company may come. So these are the way I think we can challenge this thing.
Thank you so much, Doctor. It was a pleasure having you here.
Thank you.
Thank you.